Howdy y'all, welcome back to Paulson Farms. Today we are having a pig castration day. We have two little piglets that it is their time. They are eventually going to go to freezer camp, and we don't want them to have boar taint when we eventually slaughter them. So today is their day to get castrated. Walk with me over here. I'll go through with what all we're going to use. Very simple. Make sure you have some gloves. They can be sterile or non-sterile. You're going to want iodine to clean up the site, alcohol to sterilize your instruments if they're not already sterile, like this 15 blade. Hydrogen peroxide, I just have that for at the very end. I'm going to douse it just in case I did contaminate something. It'll clean up the area as best as possible. And then, unlike some people, I'm actually going to use something to tie off the arteries, because I think it's a little barbaric to leave them bleeding after we're done, although that is some people's old school practice. But we'll get to it in just a minute.
It's going.
All right, here we go. So I've got the tools and the alcohol. I've got all my bottles already open. Got my gloves. We got a piglet. All right, show me the patient, please. I'm in position. Again, this isn't sterile, but try to keep everything as clean as possible. All right, so you can very clearly see the testicles. This piglet has a little bit of fleas, but there's a different approach you can do it. You can do it with 2 incisions or 1 down the midline. I usually do 2. It makes extraction a heck of a lot easier, but then you have double the risk of double the risk of infection. But it does make extraction of the testicles super easy. Again, this is just iodine or 10% iodine solution. Helps clean the site. And you're gonna go right down midline on both testicles. Sorry, not midline, but right down the middle of both testicles. Quick incisions, and here we go. All right, site is exposed. Recap my blade. Now's the time for some blunt dissection. Those have been soaking in the alcohol for about 2 minutes or so. That should be more than long enough. Blunt dissection is a little bit more peaceful to the tissues. The tissue layers helps reduce bleeding. And then once you get decent amount blunt dissected, you can just pop those bad boys out of there. This one still needs a little bit. Turn your head and cough. That's a joke for the boys out there. All right, both testicles are exposed. Now you just need to find the artery going to them, which appears to be on that side. All right, it's gonna hurt a little bit. So just put a clamp on it, grab your suture or whatever you're going to use to tie it off, if you do plan on tying it off. You're going to go on the back side of that homestead. You're going to have to get underneath it, just like that. And then a simple square knot is more than enough. Just make sure it's nice and tight. And cinch it all the way down. And he's a little grumpy, as can be expected. All right. Ended up not even using my nuts and bombs. That's fine. These are just to cut the suture. Put these back in the alcohol since I'm not using them. Alright. Now switching over to actually, that's what I had my nuts and bombs for. Brain fart. So it's all good. Yeah, now that you got the artery clamped off and tied off, you just snip on the top side of this and Bob's your uncle. Then take it, find that membrane that you sutured underneath. All right, there's one. I got a little baggie here. I'm gonna toss those in there for dog snacks. All right, now let's find. Oh, you're good. Let's find the second one. Just give it a little light tension until that artery shows itself. You can use blunt dissection and peel that membrane back. There's that artery. The vas deferens also runs parallel with the artery in the same tract. So when you do this, aside from removal of the testicle, you know that you're getting complete sterilization. Oops. Got me a rat's nest. There we go. All right, so just repeat the process from the first one. Go underneath that hemostat or cryo clamp. It's not a Kelly clamp, it's a straight hemostat. And again, just a simple square knot is all you need. And cinch it down real tight. This step isn't necessary, as I mentioned earlier. Old school farmers won't even tie anything off. They'll just snip the testicles, or I've heard stories where they twist them off with some sort of machine and let the pigs bleed a little bit. Apparently it's very minimal blood loss, but if you work with pediatric patients or, you know, in the real hospital, you know that in small things, blood loss is a little bit more catastrophic. So I'm trying to be a little bit more gentle. There we go. All right, patient number one is basically done. I just need to dump on some peroxide, and then he will be on his way, none the wiser. Peroxide. All right, patient number one is complete.
Go on, little piggy.